And actually what I actually tell my patients is there are as many hearing aids as there are individuals, and there's ultimately a reason for that. Every person's background, every person's hearing loss, every person's insurance coverage and financial need varies and is different, as well as their communication needs, right? So everyone finds themselves in different environments and has different communication needs and ways that they connect with others. So I think the amount of solutions, whether it's over the counter or prescription hearing aids, are warranted because there are as many people as there are solutions, and we need to make sure that we're appropriately guiding the patient in what their communication needs are and supporting them in what works best for their kind of profile and their lifestyle.
Okay. So if somebody is just starting their process, they realize, hey, there's something wrong, I need to hear better. What they're just beginning to research it. How would you explain the difference just between OTC, over the counter, and prescription devices? What are the basics?
Yeah, sure. So over-the-counter hearing aids is a direct-to-consumer option. So that means, similar to what you suggested, someone thinks they have an issue, it's never really been explored. They may do like an online hearing evaluation or hearing screening, really, and they've been identified to have some level of hearing loss or some level of difficulty, and they're curious about, what would it sound like to hear better. And that's like the typical profile when I'm managing a patient who, let's say, decides to pursue an over-the-counter device. They are usually curious whether they have some level of hearing loss. They'll do an online hearing test and they'll test drive an over-the-counter hearing aid. Most of the time, it's a generically fit device that's meant for individuals that have mild to moderate hearing loss. There's minimal flexibility in terms of how the adjustments can be made. They'll usually maybe have some application or something that gives them a little bit of control, but for the most part, it's meant to be like a one size fits all. So there's some element of customization, let's say, for the patient when it's direct to consumer, but it's not like a prescription hearing aid that's really not only fine-tuned with the individual's hearing levels and prescriptions based off of a comprehensive hearing test and an audiogram, but also in terms of the fit of the ear that is highly customized to the patient.